There we go. Hi, everyone. My name's Amy Schweikart. I'm from the North Suburban YMCA. Thank you for joining us today. We've got Denise here with us. Denise Schwartz, she's from the Manual Touch. She's a licensed physical therapist. Denise focuses on more holistic approaches to help heal pain and identify the sources of those pains. Today's talk is called Heal Low Back Pain and Sky. You're going to have to help me with this one.
Sciatica.
Sciatica. I have it in my
Sciatica.
head and I always say it differently. Sciatica. So today Denise is going to help us find the three main causes and how to heal them naturally. We will be able to answer any questions. If you have questions during the conversation, feel free to pop them in the chat and I can let you know, Denise. And yeah, so the YMCA Education Series is a free series that is open to the public. As you know, the YMCA is a nonprofit and we're always happy to receive any type of donation. You can check us out at our website at NSYMCA. And again, thank you so much for joining us. And we will let Denise take it away. Thank you so much, Denise.
Thanks, Amy. I'm going to share my screen. A second. All right, and I am going to hide everybody and myself, although you should still be able to see me, but I can't see myself or anyone else. So as Amy said, if you have any questions, put it in the chat box, or please wait till the end or write it down and let us know at the end, okay? And you can see my mouse, right, Amy?
Yeah, we can.
Okay. All right, well, welcome. Thank you to Amy and the Northbrook Y for having me. I really enjoy doing these presentations. We were just talking, I think I've been doing them for at least 6 or 7 years. So it's really nice to see some new people and be able to do this. As Amy said, I am a physical therapist. I am the owner of the Manual Touch Physical Therapy here in Wheeling. I'm at the corner of Milwaukee and Dundee, just outside of Northbrook, so very close to you guys. We use a whole body approach of traditional and non-traditional therapies to get people back doing the things that they love to do. When I first got out of school many years ago, I knew that back pain was the #1 reason people went to see their doctor. So I took a lot of continuing education to become an expert in working with back pain and sciatica. I learned some very traditional approaches to that. And as I went along, of course, I took lots of classes on how to work on all the parts of the body. So becoming an expert in really some nuanced way of treating everybody, no matter what kind of pain they had or injury. Along the way, I started studying a non-traditional therapy called integrative manual therapy. And it's a whole body approach of hands-on work, finding where in the body is preventing you from healing. I used to work at Lutheran General. I left the hospital to work for the company for 6 or 7 years. We had a clinic here in my Wheeling office. And then when we parted ways in 2010, I just became the Manual Touch Physical Therapy. When I went to work for the Center MT, I really was just doing the integrated manual therapy, the hands-on approach. And I realized I threw out a lot of traditional stuff that really worked well. People really needed both approaches. So when I opened my practice in 2010, I combined the two. I used some traditional hands-on techniques, traditional exercises, as well as non-traditional hands-on techniques and non-traditional exercises to really look at the whole body and how to find out why someone isn't healing and hasn't gotten over their pain. As a result, I often see people who have not gotten better elsewhere. I see people who, unfortunately, through their business model at other PT clinics, they just can't see people as long as that I might be able to see someone. So I'll wind up seeing them as well to get them really nuanced and back to doing what they love to do. Along the way, I had developed a passion for running and became a certified running coach. And then I have a certification in applied functional science, which is a whole body approach of exercise, looking for where in the body is preventing you from healing. So for like today's example of back pain, a lot of times, sometimes the foot and the ankle is limiting you from moving in that area, so that you wind up overusing your back, thus you get a back injury. So it's really about looking at all those pieces and to see where it's coming from. I've added a component called an OOV and balance it, and I do some run analysis. We'll talk about that, the OOV, later. This is a run analysis. I videotape people running on the treadmill. So maybe your back pain is preventing you from doing the things you love to do. Here I am kayaking in Alaska, and I know for some people that could be very uncomfortable to sit in that position. Maybe you want to get back to golf again and not really hurt your back. You want to travel, or maybe you just want to hang out with your friends cooking, or it's really hard to cook anymore and standing because of your back pain. Or maybe you want to be really a real major goal. I love this story. I met these 3 women when I did the Tampa half marathon. Gosh, how long ago was that? I don't know, over 10 years ago, maybe even longer. And I noticed these 3 women with these with the medals already around their neck, and this was the day before the race. And this woman had this cute little happy birthday sign. At any rate, these 3 women, ranging in age from 70 to 80, had just walked the 5K, and they were going to walk the 10K and then walk the half marathon the next day. So they were doing all triple, and they were 70 to 80 years old. And so, they keep themselves active. Their goal at that time was to walk across America. And I kept in touch with them, and they did succeed. They started in Florida. They walked 3-4 months to Texas. I think they took a break for a few months, and then they went back to Texas and walked the rest of the way across the country. So there is no age limit on what you can or can't do. It's just learning how to use your body effectively, efficiently, to prevent and build strength so you can do all those things that you love to do. So I mentioned this in the beginning. What's the number 1 reason people go to see their doctor? Low back pain or sciatica. So today we're going to talk about the 3 common diagnoses that I will see in my clinic. There are certainly others. And I'm going to talk to you about a musculoskeletal diagnosis that's really you're not going to see on pictures, that are quite often is the primary problem. Talk about anatomy and what you can do about it. So what are some of the common pain complaints? People will complain of pain in their back or leg with walking, and sometimes people feel better after walking 10 minutes, and sometimes their pain is worse after walking 10 minutes. Same thing with standing. They can stand, they feel a little bit better after standing a while, or at about 10 minutes, they're like, I have to sit down, my legs are too sore. Bending over lifting might increase their pain. Sitting, driving, getting in and out of the car, going from sit to stand, rolling over in bed, getting out of bed, any of those transitional movements might increase their pain. They may have pain in their back, their buttock, or down their leg, all of which could be coming from your back. Sometimes they'll have numbness or tingling in the buttock, leg, or foot, which often is because it's something going on in your back. People complain of just stiffness or pain or stiffness first thing in the morning, and then when they move, they feel better. Sometimes they'll say their back feels like it needs to crack. So we get a lot of different complaints, and based on what we call that subjective information, gives us some clue as to what's going on and what might be causing it. So that's the first step. The 3 most common diagnoses are herniated, or sometimes known as a bulging disc or a slip disc, lumbar or foraminal stenosis, degenerative disc disease, arthritis, or sacroiliac joint dysfunction. And I'm going to talk a little about the anatomy now and what that looks like when you have any of those 3 things. I have an ebook on my website, or if you want me to send this to you, put your first and last name and your email in the chat box. I'll be happy to send this ebook to you for some tips on how to prevent pain and injury to your low back. So I love this little graphic of the dancing skeletons because it shows you how everything is connected. So just because we see something wrong in your back or your back hurts, it doesn't necessarily mean that that's the primary problem. It may be where the area is injured or you're feeling the pain, but it could be because of somewhere else. Because if you can't kind of dance around like this because your feet can't do what they do, or your knees or your hips, or even up here, then something is going to get injured. This is a side view of your spine. You have 7 cervical vertebrae up here, that's your neck. And then your mid back are 12 thoracic vertebrae. And then the low back are 5 lumbar vertebrae. Below that is your sacrum. And way down here is your coccyx or tailbone. The pelvis is right here, down at the bottom. And you can see how your skull is right at the top. And there's your jaw, very close to the top of your spine. You can see here in between, these are all the bones. Those are the vertebrae. Those are the bones. In between what we call the body of the vertebrae, which is on the inside, because here's the front of you. These are your discs in between each body of vertebrae. And then, I don't know if you can tell, there's, let's see here. I thought I had a better picture. Anyway, the spinal cord comes down, attaches to your brain up there, comes down through a hole through all the vertebrae, all the way down here, okay? And off of vertebrae, between each vertebrae, off of the spinal cord, between each vertebrae is a nerve that comes out and goes to the rest of your body. And that area is called your foramen. So those of you who've had MRIs, maybe you'll see on there foraminal stenosis. This is the foramen. And that's really just an opening. And stenosis means a narrowing. And so this area has become arthritic and narrow. And so it's impinging the nerve as it's coming out. Usually you'll have one-sided leg pain because of that. When you have spinal stenosis, it's actually more of a stenosis in the canal where the spine is coming down, and it pinches off in one area. And usually that will cause bilateral leg pain. Both legs will be sore from that. This is just the lumbar vertebrae, the lumbar spine down at the low back. Here's that sacrum. Here, this blue is the disc. This is the spinal cord you can see coming out. The nerves coming out between those foramen. And if you can see this little pink thing, that's when the disc gets a little herniated. It doesn't often look that dramatic. So the disc is made up of a jelly-filled center, kind of like a jelly donut, and that's the nucleus. And what happens when someone herniates a disc is that nucleus shifts and bulges out on the outside of the disc, which is a ligament. And that ligament is inflamed and presses on the nerve. And that's how you get nerve pain down your leg. Which leads me to the longest nerve in your body, and largest, called your sciatic nerve. And that comes out from 3 sections of your spine, right here, the sciatic nerve, and it comes down over your, underneath the buttock muscles, and it runs between some muscles here, okay? And it goes all the way down the leg, and it splits behind the knee and goes all the way down to the foot. So you can get numbness, tingling, or pain anywhere along that length of that nerve. So you might have it in your back of your thigh, you might have it in your butt. I have a man right now who his whole left foot is numb and painful. And it's all because of some impingement up in the back. Now, sometimes, so that's a herniated disc could be causing that sciatic, and it would be at one of these segments. It could be stenosis or this foraminal stenosis impinging on it. You can also get sciatic from, this is your sacroiliac joint. This is the sacrum, and this is the ilium, and that's where it comes together. So sometimes this is where sometimes you feel like your pelvis is kind of locked up, or it hurts to lift your leg to put it into the car, or to do stairs, or cross your legs, or lay on your back, because there's been just a slight little shift in here because some muscle had gotten strained here, and it kind of causes like what feels like a little bit of a rotation in the ilium. So you get a strained muscle here, kind of pulls it into a position, gets it stuck. That muscle impinges the sciatic nerve, you get pain down the leg. Sometimes it's just an arthritic condition here in the SI joint, and it's very stiff and doesn't move very well. So we have to sort of tackle both, this area as well as up in here. I do find that when someone comes in with severe acute pain, sometimes it's just the SI joint, and that's usually pretty easy to take care of with some manual therapy. But sometimes it is coming from the spine, whether a herniated disc or stenosis, but your body is sort of adapted and the SI joint is also affected. So we work on that. That settles some of the acute pain down, and then we can deal with the lumbar spine. So how many of you have heard of your core muscles? So now we've talked about your inner spine, the vertebrae, all the tissues that go into that area. And this your core muscles, which goes from your diaphragm, every muscle from your diaphragm down to your pelvic floor. And it goes in the front of your back, your abdomen, and in the back. That's all considered your core muscles. And that's what protects your spine. So that's why when you come in for physical therapy, we do a lot of exercises for these muscles. Now, a lot of times people have acute back pain, like really bad, and they barely can move or they can't breathe. And that's your back, all these core muscles, or particularly just the back muscle, spasming to protect, to create this like girdle around your spine to protect the more vital structures underneath. So you might go into the doctor, they might give you muscle relaxants to relax those muscles, when in fact, really those muscles are spasming and getting tight to protect the more vital structure of your spinal cord and your spinal nerves, and maybe even organs or blood vessels in here. So, sometimes you need the muscle relaxant, but you also really need like an anti-inflammatory to calm down what's going on internally. So the muscles around it do not need to spasm. Our bodies are really smart. They know they need to protect the more vital structures. Your muscles, they're important, but they're not as vital as your spinal cord and your blood vessels. Okay. Now, those core muscles hold us upright. And over time, everybody's posture changes. Sometimes as we grow from children on, we develop weird postural patterns, not through anybody's fault. It's just you have weaknesses in certain area or you have a propensity towards it. As we get older, we might become more rounded here. And as a result, we might get more arch in the low back, or we might get more of a flattening down here, back here, or up there. And as a result, our muscles can't work efficiently or optimally. They get stretched out in certain areas. They get shortened in other areas. They become weak, and they can't support us as well. So even though what I talked about, the three primary diagnoses, more often than not, you may have one of those, but a lot of people don't have, the pictures, their MRIs look okay, x-rays look okay, or even if they don't look okay, their primary problem is weakness and postural weakness and weakness in these muscles not working together very well. I call that postural weakness and immobility. So some people, their hips are stiff or their ankles don't move, and the ankles get stiff, they don't move, their hips don't move. So then they try to move here, they develop a problem in their back. So being sitting around, people who sit a lot at work get this a lot. And sometimes you do get, one of the major diagnoses is from sitting a lot. More often than not, this is age related here, the stenosis or arthritis. The SI joint or the herniated disc tends to be more of an injury problem. But this is a nice little chart to show you what may or may not be going on. Again, if you put your first and last name and your email in the chat box, I'll be happy to send you this PowerPoint with all this wonderful information in it. So I get a lot of people come in, oh, I have a herniated disc I've had 20 years ago. Well, it kind of sets up as a weak link, but really, more often than not, people have adapted to move and function to the best of their ability subconsciously to avoid that pain or prevent injury. And sometimes you develop poor patterns. And so we really need to work on people to build up their strength and learn how to move the right way. I have another ebook that I'll send you as well to talk about how to function throughout your day, how to sit and how to stand and how to walk, using your body as optimally as possible. Lately, I have been noticing a lot of people, how many of you, and you can put it in the chat box, were told to throw your shoulders back and chest up when you walk and sit? I would lay odds everybody. And what happens is particularly as you get older, is you just wind up bending backwards here in the mid back, okay? And as a result, these muscles here have to work really hard to hold all this weight up here. Plus, if I were to come and blow on you or even slightly move, you would be so unstable in here, nothing is holding up. So here is a tip. A lot of people, their chest is up here because they're thinking they need to hold their shoulders back. And now they have back pain because their back is working too hard. All you need to do is lower your chest down. And you will all feel like this, but you're not. You're just like that. Okay? And it straightens up. So just a little bit of a tip. It is important for us to figure out what is going on, particularly if you're having numbness, tingling in your leg, what is going on, because the diagnosis, if there's something going on in your spine, there are certain exercises. There are plenty of exercises that overlap no matter what the diagnosis is. However, for some, you don't want to do for others. For what we might do for stenosis, we would not do for herniated disc and vice versa. And if somebody has osteoporosis, that throws another little monkey wrench in there that we may or may not want to do certain exercises. So it really is important to know. So I don't give out exercises here that are spot specific until we know what's going on. However, there are a lot that overlap, and there are definitely certain postural and balance things that you can do will help strengthen up your core that are important. So how do we know if physical therapy will help? Well, first off, your pain or symptoms need to be reproducible. What does that mean? My legs hurt when I stand or walk for 10 minutes, then I need to sit down. But when I sit down, it goes away and I feel fine. My back hurts when I bend over, but if I'm walking or standing, I'm okay. That's reproducible. So then we know that therapy can help. What is not reproducible? So those of you who've been on with me before may have heard this story, but those of you who haven't, about, 7 or 8 years ago, I'm lucky I typically do not have back pain. But one day I woke up, it was a Monday morning. I was getting ready to go for my morning run. I had some low back pain on the left side, I think. Didn't feel so bad. I went running. It didn't make it worse, didn't make it better. By the next day, it was starting to travel around to my abdomen. And I couldn't quite figure out what was going on. By day 3, I couldn't find a comfortable position to sleep in. So it was really kind of achy and hurting all the time. And by day 4, I'm like, okay, there's nothing reproducing this pain. I'm having it all the time. It's coming around. I can't find a comfortable position to be in. So I knew it was not musculoskeletal, meaning it's not coming from my spine. It's not coming from a muscle. So we went to the emergency room. Because it was my low back, they worked me up for kidney stone, etc. They couldn't find anything. I went in and I said, it's not reproducible. It's not muscle strain. It's not coming from my spine. By 2:30 in the morning, they threw up their hands and said, must be muscular. I couldn't argue. I left. A week later, the pain was starting to reduce, and they gave me pain pills, but I scratched my back and I felt a rash. So I had shingles, but I had the pain before the rash showed up. So very hard to diagnose until the rash shows up. And so then I got the antiviral. So typically physical therapy does not help shingles pain. However, there are some non-traditional therapies that can be helpful, such as acupuncture for that kind of nerve pain. So if you can't get a comfortable position, you just can't get rid of it, you really need to go see the doctor, the emergency room, because it's not reproducible. These are some stories of people who've had really good luck coming in to see us here at the Manual Touch. Let's see, helped to heal a back injury that's been bothering me for years. She really liked the exercises and the video app we used. This woman, in the past, when her back was sore, she went for therapy somewhere for 7 months, and it took a while. She came in to see me after a few visits. She was all better. And like a lot of my patients, they hear my voice in their head every time they go to do something, so they do it the right way. So what's the biggest mistake people make with sciatica or low back pain? They ignore it. Here's in Alaska. I was standing up here as a glacier. This glacier, this says this is 2005. The glacier went to here in 2005, and it's receded that long. So we don't want to keep ignoring things because it may get worse. So that's your choice. You can ignore it and kind of move on. And sometimes it goes away and you go about your business and it's not a problem until it happens again, or you develop some other issue down the line. You can alter it with medications, injections, or surgery. There is a place for this. A lot of times people do need some medication or injection. What we hope you do is handle it by coming in for some physical therapy before we get to a point where we need to do something real surgical. The surgeons know when you really need it, and we know when you really need to go see someone as well. So what happens in physical therapy? We'll do some hands-on work called manual therapy, and we'll work on different joints to make sure all the joints are moving the way they're supposed to and there's good joint play. We'll work on any of the soft tissues that may be bound up. Scar tissue is a big issue. Your abdomen is the front of your back. So any scar tissue or abdominal surgery you may have had in the past could be limiting what's going on in your back. So we will work on those tissues in the front. Exercises, we'll give you strengthening exercises for your core, hips, feet, really to get everything working together. We're going to give you a lot of mobility exercises to make sure you have enough play, enough movement in all of your joints, balance exercises, and more importantly, we're going to give you what's called neuromuscular re-education to really teach your body how to work together, how to get your feet working with your core, a real whole body integration. And really, most important, we're going to teach you how to function. So here's some of the things. Did anybody ever teach you how to sit, how to walk, stand? Probably not. But when I was in PT school, we were taught how to use our bodies effectively so we don't get injured, so we can help you. And then we educate you on how to help yourself. A lot of times, sometimes people come in here and I just have to tell them to walk with their feet a little further apart. And that makes a huge difference. How to sit and how to stand. Remember, we talked about that little trick, lower your chest down here so you're not jacking up all the muscles in your back, thus overusing the back muscles and straining them. So we're going to talk about how to sit, how to stand, how to walk, how to sit to stand, sleeping postures, how to lift appropriately, doing specific activities, whatever you might be doing. I had a woman, a flight attendant. We talked about what she does on her job, and we talked about how to do all those things on her job so she doesn't hurt herself. Maybe you want to kayak like I did in the beginning there. So we'll talk about how to use your body and your core efficiently to do that. People are swimmers, or the runners that come to see me will talk about running form and spot-specific exercises for that. Or maybe you just want to cook, or you're just doing everyday activity, cleaning house, putting things away, lifting, how to do laundry. So we'll talk about that as well. One of the tools I've added into my practice the last 5 years is called an Y.E.S. This is a really unique piece of equipment. It was designed by an Australian osteopath and biomedical engineer. It works your body three-dimensionally, so you cannot compensate. It will activate your core to work subconsciously like it's supposed to as you function through your life. You can lay on your back, on your stomach. Here's a woman on her back. I have an older gentleman here. I have it between his back and the wall. You can stand on it. You can lay on your stomach. We can lay on your side. There's all sorts of positions in it, and it doesn't matter what age you are. We can find some tool here to re-educate your body. I feel like it's the best tool I've ever discovered to really re-educate you on how to move and how to stabilize your core. Then he came up with a new device during the pandemic called a balance sit. So you can sit on something, okay? And this, of course, gets your core activated and your pelvic floor. And it really works on getting the hips and the pelvis working together. A lot of my patients love these two devices a lot, and they wind up purchasing one for home. As far as the prices of equipment, it's really very nominal. This is that ebook to teach you how to function throughout your day, with a lot of chock full of tips. So again, if you put your first and last name and your email in the chat box, I will be happy to send this to you. Here's a woman, let's see, after withstanding severe lower back pain and epidural, which didn't help a whole lot, but once I gave her some exercises and education, and she started using them throughout her day, she now feels really just fine and can do everything she likes to do. Here's a woman who has had back pain for 20 years, and until she came in to see us, we really got it under control and feels much better. What can you do right now before you come in to see us or you see a doctor? Make sure you're not sitting all day long. Make sure you get up every 60 to 90 minutes or even more and move around, walk around the house, walk sideways around the house, because that'll start strengthening up your hips. It'll help you with your balance as well. Get my ebook to learn how to function throughout your day. Email me with any questions. And email me so we can set up a phone call or a telehealth session to discuss what's going on with you. Or better yet, if you're ready to take care of your problem, if you are on Medicare, you do need a prescription from your doctor. If you are not on Medicare, you can just come in and see us. So just give us a call and we'll get you scheduled. Okay, I think that's everything. Here's my information. And again, if you put your first and last name and your email in the chat box, I will be happy to send you all this information, including the the PowerPoint presentation. So let's see, where's the chat box? See if anybody has some questions in the chat box. Oh, no questions. Anyone?
I have a question, Denise.
Hi, Amy.
Hi. So how long does it typically take to get a diagnosis to figure out where the lower back pain's coming from?
Well, more often than not, based on your subjective information, we can tell pretty much right away what more than likely is causing it.
Oh,
So
okay.
stenosis is it's always, oh, my legs hurt after 10 minutes. So it's almost always stenosis. If someone has acute pain and they're kind of side bent and they can't bend over, or sitting is worse, that's usually a herniated disc. So we usually know what's going on pretty quickly before we do an MRI. The doctors and the therapists don't really need those pictures right away. We can tell what's going on because sometimes things look worse on a picture when that's really not the case. With that being said, the doctors, if you see the doctor first, they'll do an x-ray to rule out the worst, which would be a tumor or cancer, because they'll see that on an x-ray. Stenosis or herniated disc, you do an MRI. But more often than not, they'll send you to therapy first. They might give you some steroids, anti-inflammatories.
Great.
And based on what you tell us and our evaluation, we kind of know more than likely what's going on, and we work with that.
That's wonderful. I was thinking like, months or weeks, but that's great.
Yeah. And then if, you're not getting better in therapy, or things are just, there's a lot of nerve pain, or you got really significant nerve issues such as weakness or incontinence, or your foot is dropping, you go to the doctor, surgeon, and MRIs right away.
Sure. Yeah.
Yeah. So that's why, if you're having a problem, like let's say you were working in the garage all weekend and all of a sudden you can't straighten up, come in and see us right away, because there's probably stuff we can do.
Yeah.
Yeah.
Oh, great.
Okay. Anything else? Well, thank you for coming. And well, I think I'm doing another talk in November.
That's
I don't remember what it's for. But thank you for having us. And
yeah.
all right. I always enjoy
Yeah.
doing these things, so it's very fun.
Thank you so much, Denise. And please, everyone, if you want to get her free ebook, put your name and email up in the chat. And then you can always visit her at themanualtouch.com. And yeah, and we'll have this webinar up on our YouTube series, so you can send it along to anyone that wasn't able to make it today. And thank you again, Denise. This was wonderful and very helpful. Oh, go ahead.
Yeah, one more thing. If you know someone, a friend or family member who could really benefit from taking care of their back pain, let us know. Give them our
Yeah.
name.
Great. All right.
Thank
Thank
you.
you,
Take
Denise.
care.
We'll see you soon.
All right. Enjoy the
Bye,
weather. Bye.
everyone. Take care.